Imagine you are going about your daily routine when suddenly you feel unusual pain in your leg, a shortness of breath, or a strange persistent headache. These seemingly minor symptoms can be easy to ignore, but they might be trying to tell you something much more serious. Blood clots, which many of us associate with cuts or injuries, can silently develop inside your blood vessel, posing life-threatening risks by blocking your circulation. So stay tuned as we delve into 8 warning signals. We will uncover how to identify these silent alarms your body sends, empowering you to act swiftly and safeguard your health. Your health is too important to leave to chance. Let's get started. Blood clots are more than just a consequence of injuries. They represent a serious health concern when they block blood vessels, disrupting normal circulation. Here are 8 warning signs of blood clots. Swelling is often the first sign of a blood clot, signaling an underlying issue that should never be ignored. While occasional swelling may be harmless, sudden and pronounced swelling in a specific limb, such as a leg or arm, demands immediate attention. This type of swelling, known as edema, occurs when a blood vessel is blocked, hindering normal blood flow and causing fluid buildup. What sets clot-related swelling apart is its persistence. Unlike swelling from minor injuries, which may subside with rest and elevation, swelling caused by a blood clot tends to linger and may worsen over time. It's often accompanied by sensations of warmth and tenderness in the affected area. When these symptoms coincide, the likelihood of a blood clot becomes even more apparent. Prompt action is crucial when swelling is observed, especially when it's localized and accompanied by discomfort. Ignoring such signs can have serious consequences, as blood clots have the potential to dislodge and travel to critical organs like the lungs, leading to life-threatening situations. Healthcare professionals can conduct tests to confirm the presence of a blood clot and recommend appropriate treatments to prevent further complications. Pain or tenderness as the second warning sign of blood clots is a crucial indication of potential vascular issues. When unexplained discomfort or tenderness arises in a specific region of the body, particularly in the arms or legs, it should raise immediate concern. This pain often presents alongside other symptoms such as redness and warmth, forming a distinctive pattern that suggests the presence of a blood clot. The nature of pain associated with blood clots is unique. It can vary from a sharp stabbing sensation to a persistent ache, reflecting the clot's obstruction of normal blood flow and the resulting strain on surrounding tissue. Additionally, the affected area may feel warmer due to increased inflammation caused by the clot. Disregarding these symptoms may lead to the clot dislodging and traveling to other parts of the body, posing severe risks. If pain persists, worsens, or is accompanied by other warning signs like swelling or skin discoloration, seeking professional medical evaluation becomes imperative. In essence, understanding the significance of pain or tenderness and taking timely action can be instrumental in safeguarding your health and minimizing the impact of complications. Skin discoloration, the third indicator of blood clots, provides a visual cue that should not be conditions. Blood clot-related pain emerges abruptly. Its unexpected appearance, combined with its localized nature, should prompt individuals to seek immediate medical attention. Recognizing and addressing pain or tenderness promptly can play a pivotal role in preventing serious complications from blood clots. When an area of the skin appears bluish or reddish, it may signify compromised blood flow due to a clot. This change occurs because the clot obstructs the blood vessel, leading to reduced oxygen supply to the affected region. The skin, particularly in areas with thinner skin like the legs and arms, takes on an unusual hue as a result. Unlike temporary discoloration from minor injuries, clot-related skin discoloration tends to persist and worsen over time. Additionally, the affected area may feel warmer to the touch due to inflammation caused by the clot. It's crucial to pay attention to any unusual color changes, especially if they're accompanied by other symptoms like swelling or pain. Recognizing skin discoloration as a potential warning sign of blood clots empowers individuals to take proactive steps toward their health. Seeking medical evaluation when such changes are observed can lead to early detection and intervention, reducing the risk of complications. Shortness of breath, the fourth warning sign of blood clots, requires immediate attention due to its potential connection to serious health risks. Although shortness of breath can arise from various causes, sudden and unexplained breathlessness could indicate a pulmonary embolism, a condition where blood clots block blood vessels in the lungs, impeding oxygen exchange. This blockage can lead to sudden and severe shortness of breath, chest pain, and a rapid heart rate. In severe cases, it might even result in fainting or loss of consciousness. Since pulmonary embolism is a critical medical emergency, Immediate medical attention is crucial if you experience sudden and severe shortness of breath, especially if accompanied by chest pain, lightheadedness, or a rapid heart rate. Because shortness of breath can also be a symptom of other conditions, it's important to consider the context in which it occurs. Understanding the significance of shortness of breath and its potential connection to blood clots can be life-saving. Rapid intervention and medical evaluation are essential in such cases to ensure timely treatment and reduce the risk of severe complications. Chest pain, as the fifth warning sign of blood clots, requires careful attention due to its association with potentially life-threatening conditions. While chest pain can stem from various causes, sudden and unexplained chest discomfort should raise concerns about the possibility of a blood clot. It can feel sharp or stabbing and may be accompanied by symptoms such as shortness of breath, rapid heart rate, and anxiety. It's crucial to distinguish between chest pain related to a heart attack and that linked to a blood clot. Heart attack-related pain, on the other hand, may radiate to the left arm, neck, or jaw and is often accompanied by nausea and sweating. If you experience sudden and unexplained chest pain, especially with difficulty breathing, seeking emergency medical care is crucial. Ignoring such symptoms could lead to severe complications, including potential damage to the heart or lungs. The sixth warning sign of blood clots should never be dismissed lightly, as they may indicate a potentially serious medical condition. When blood clots disrupt blood flow to the brain, episodes of dizziness, lightheadedness, and fainting can occur. These symptoms arise when the brain lacks sufficient oxygen and nutrients due to blockages in the blood vessels. Dizziness may present as a sensation of spinning or unsteadiness and can occur suddenly and unpredictably. Fainting, on the other hand, represents a more extreme manifestation of reduced blood flow to the brain, resulting in temporary loss of consciousness. If you experience recurring dizziness, lightheadedness, or fainting, it's crucial to consult a healthcare professional for proper evaluation. An unexplained cough, the seventh warning sign of blood clots, should never be brushed aside as a minor inconvenience. It may signify a potentially serious condition like a pulmonary embolism, a blood clot in the lungs. While coughing is often associated with respiratory issues, a persistent and unusual cough, especially when coupled with other concerning symptoms, demands attention. Unlike a typical cough that might subside with time, a clot-related cough tends to persist and might worsen, often accompanied by sharp chest pain. Understanding the potential implications of an unexplained cough and being proactive in addressing it can lead to early detection and intervention. Prioritizing your health by seeking medical evaluation for persistent and unusual symptoms is a prudent step toward ensuring your well-being. Numbness or weakness, the eighth warning sign of blood clots, holds significant implications for your health and should not be disregarded. Sudden sensations of numbness or weakness in a specific limb might indicate compromised blood flow due to a clot. When a blood clot obstructs a blood vessel, it can impede the normal circulation of oxygen-rich blood, leading to numbness or weakness in the affected area. This can result in a tingling or pins and needles sensation or even difficulty moving the limb altogether. Unlike gradual numbness that might result from pressure or certain medical conditions, clot-related numbness tends to appear suddenly and might be accompanied by other warning signs such as pain or swelling. Recognizing numbness or weakness as a potential indicator of blood clots empowers individuals to take proactive steps toward their health. Seeking medical evaluation when such sensations arise can lead to early detection and intervention, potentially reducing the risk of complications. If numbness or weakness persists, worsens, or is accompanied by other concerning symptoms, a professional medical assessment is strongly recommended. Healthcare providers can perform tests to diagnose the underlying cause, such as a blood clot, and recommend appropriate treatments to prevent further complications. In essence, understanding the significance of numbness or weakness as a warning sign of blood clots and responding promptly can contribute to safeguarding your health and minimizing the impact of potential complications. Your well-being is best served by paying heed to these signals and seeking medical guidance when needed. In conclusion, recognizing the warning signs of blood clots, from swelling and pain to skin discoloration, shortness of breath, chest pain, coughing, numbness, and weakness, is crucial for maintaining good health and preventing severe complications. These signs, which can sometimes be subtle, serve as red flags that prompt individuals to seek medical attention and intervention. Understanding the significance of these symptoms and being proactive in seeking medical evaluation can lead to early detection and intervention, reducing the risk of complications. Early detection can often be the key to managing blood clot-related issues effectively, highlighting the importance of staying vigilant and responsive to our body's signals. Thank you for watching this video. If you have found it helpful, please give this video a thumbs up and consider subscribing to our channel. See you next time.